It doesn't have to become a huge focus.
Allison O'Neill specializes in what she calls appearance therapy. Working with patients who often face debilitating injuries and skin conditions, she helps people like Carter cope with potentially embarrassing outbreaks of psoriasis.
It's not pretty right now, but it's a lot prettier than during the wintertime when it really flares up bad.
Allison is going to help Carter minimize the appearance of his outbreaks with a technique called paramedical cosmetology, or corrective camouflage.
But ideally, you'd want to do this on an area that's not scaled up.
Preferably not scaled up, so use your medications and the scaling gets under control, then you can camouflage the discoloration.
Right.
Begin by working with your doctor to find a medication to bring your scaling under control. And remember, never apply corrective camouflage to open skin lesions, unhealed cuts, or raw or irritated skin.
This product I'm going to show you is pretty much in general how most of these products are made with the same ingredients. It's waterproof. It doesn't just come off with soap and water.
Camouflage products can be purchased through makeup specialists or even over the counter. Since most contain talc that wicks away natural moisture and can potentially irritate, it's best to start with a protective moisturizing barrier. Then it's a matter of matching skin tone, which usually requires a blend of several shades of concealer.
Here's your normal skin tone right here, mixed with the green and then some of the red. It's okay to have some of the red shine through, but I'm going to get a different shade.
Use an applicator to get the product from the container. But to blend and apply, use your fingers. A little concealer goes a long way.
If you can't see your fingerprint, you have too much product on your finger. Look for the fingerprint and then and then you're going to tap and press it right into the skin, just like we did on your finger, which is the firm pressure which lays the base. All we want to do on your cheek is kind of break up the redness, and we don't need a whole lot of it.
Only light pressure is needed to pat the application. Too much pressure will likely result in the product coming off and sticking to your fingers. Because of the scaling and creases psoriasis can cause, be sure to take your time.
This may take 3-4 set kind of applications. And the reason you use your hand is because the warmth of your finger actually warms this product so that it'll actually stay in place.
Don't get frustrated if you don't achieve 100% coverage. Perfection is not the goal in working with cosmetic camouflage.
You can get 100% improvement if you're going to have a photograph taken, and then it looks normal. But if you get beyond 65, 70%, usually it looks like there's a product covering.
Also remember that while you may know where the outbreak is, other people do not. Having camouflage should help make it easier to keep it that way. For WebMD, I'm Janice McDonald.